not to do the background commentary, just do whatever you are doing in the exam. If anything abnormality, anything pathology, I will tell you, otherwise you will do whatever you are doing. Okay.
Okay. So just again.
Yes, you are talking to the child and the mother. You are just talking to whatever you will question with the child and the mother, I will reply you.
Okay. Child name is
John.
Mother name is Sarah.
Mary.
Okay. Fine. So
You may start now.
start now. Okay. Hello. Good morning.
Good morning, doctor.
I'm Dr. Hiren, one of the doctor here. Today I'm going to examine John. Is that okay with you, Mom?
Yes, sure, doctor.
Yes. I'm just washing my hand and having a quick look around John, whether there is any special surrounding, any.
No need to say.
Okay.
Just look at the in front of you. Picture is there.
Okay. All right. So, hi, John. Hello.
Hello, doctor.
You have a very nice toy. I like your color of your T-shirt. Looks very
Thank
nice.
you, doctor.
So, John, what did you eat today?
Doctor, I took I took biscuits just 30 minutes before.
Okay. Okay. So, after cleaning the hands, I'm just checking. John, does it sore anywhere? Today, I'm going to uh, have a look of your eyes, your hands, and I'm going to feel your tummy.
Okay, doctor. Like another doctor did before, right?
Yes, 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 John.
Okay.
All right, so John, can I have a look at your hand, please? I'm looking for any clubbing, cyanosis, any peripheral
No
stick.
need to repeat.
Okay. So, is there anything in the hands?
If anything, I will let you know. You just carry on.
Yeah. Having a look at, I'm having a feel of the pulse. Okay, 80 per minutes or whatever you told me.
Normal, regular.
Okay. Now I'm going to have a look at both the dorsum of the hand for any scar, any cannula scar, any marks are there or not.
No need to say. Just carry on.
Okay, John, please look up and
Yes,
again
doctor.
down. Okay. And
Yes.
John, can you open your mouth and stick out your tongue? Okay. Now I'm going to have a feel of your neck. Okay. Does it hurt anywhere? If it hurts,
No, doctor.
let me know. Okay. All right. Now, John, I'm going to have a feel your tummy. Can you please take off your shirt? Mom, can you take off the shirt of John?
Yes, sure, doctor. Is it okay, doctor? I just remove on the belly.
That's fine. Yes. Yes. Okay. All right. So, inspection, I'm looking around. Okay. Is there any?
Carry on.
All right. Okay, John. Now I'm going to look from the side and from the foot end, both sides. And okay, I can see there is a scar here. John, now I'm going to uh, feel your tummy. If you feel any pain, please stop me. Okay. First, I'm doing superficial palpation to see any tenderness is there or not. Then
There is a mild tenderness and a mass on the right lower quadrant.
mass in the
Right
right
side of the abdomen, there is the mass.
mass in the right lower quadrant. Okay. And now I'm going to again measure that mass since I feel that mass, and I'm going to John, I'm going to tap on your tummy. If it hurts, let me know. I'm
Okay.
going to percussion, especially on the mass area.
Dull reflex.
Okay, all right. So approximately what size mass? Around.
Small ball.
Okay. Now I'm going to feel for the liver again. I'm continuing with the palpation to see the
No
hepatosplenomegaly.
organomegaly.
No hepatosplenomegaly.
No.
Okay. Now I'm going to make a liver. I'm going to tap on your lower part of your chest as well as the under tummy. If it hurts, let me know. Checking the liver span.
Okay. Okay.
Okay.
Normal.
Okay. Now I'm just having a look on the back for the scar, and also I'm going to feel for the kidney, both kidneys, palpable enlargement, or I'm going to have a look, and also checking for renal tenderness, that area, whether there is any.
No.
Okay. All right. And now I'm going to listen the vowel sound as well as the any renal bruise. Vowel sound as well
No
as.
renal bruise. Vowel sounds are sluggish.
Okay. And I'm also going to have a look on the both the legs for edema.
No.
Okay. All right. So uh, to complete my examination, I would just request, I would also like to examine the hernial site and the external genitalia.
Later on, doctor.
6 minutes.
Okay. Yes, Dr. Heran, will you please explain your findings?
Okay. So to complete my examination, I would like to do the examination of the external genitalia as well as the hernial site and to measure the blood pressure. Today I have examined John, who is a 4-year-old child who doesn't have any unusual feature, who looks smaller for his age. I would like to plot his measures into appropriate centile chart. Who doesn't, he's communicating well with me, and he doesn't have any clubbing or jaundice or failure. And on examination, he has pulse of 80 per minute with non-specific character. And on abdominal examination, he has a small scar on the right lower right hypochondriac region. And his superficial palpation is non-tender, and he has a small mass on palpation on the right lower quadrant. On percussion, there is no organomegaly, and on auscultation, there are sluggish vowel sound and no renal bruise, and there is no any edema or swelling on the feet, as well as there is no tenderness on the renal area. So, putting this finding together, I would like to consider a few possibilities. The scar, which is on the right lower quadrant, and the mass and the sluggish vowel sound, probably on the top of my differential, I would like to consider uh, probably previously done bowel surgery, and also mass could be because of the constipation. Also, it could be some.
What else you want to examine if you are saying your impression is a constipation?
Yeah, I would also like to examine the back and the also for spina bifida as well as the. I would like to do also see the back passage, the anal canal, whether there is any fissure is there or not.
Have you requested for it?
No, I just requested external
But
genital.
you examined the back, but you did not comment on the low back examination, right?
Back, there is nothing. I examined back, but you did not
Mhm.
give me any finding on the back.
You examine the renal system on the back, as you said.
Yes, I see, I also examined the renal system. Yes.
Okay, but you did not comment on the low back or anything. Okay, what else you want to examine if you are saying it's a constipation?
Yeah, if it is constipation, I would like to make sure whether there is any spina bifida or any
Hello,
lower motor neuron lesion.
can you hear me?
Hello. Yes.
Hello.
Yeah, I can hear your voice. Am I audible? Is my voice clear? Hello. Is my voice
So
clear?
we can hear you, Hiren.
Okay.
Yes, we can hear you.
Okay. So I would consider like several possibilities here. The top of the differential is probably mass of the constipation. Another one is like renal transplant, but the scar is not consistent with that. Another one is probably any malignancy or any like a tumor, but the for that I need to take the history, and the other possibility is like a bowel obstruction also, but so far child doesn't look that toxic
Nine,
and very unlikely.
9 minutes. Okay, Dr. Vakar is not here. He left, but I don't know why it's constipation. Constipation mass is not coming this side.
Yes,
This side mass is from the Crohn disease, really.
yeah, actually constipation mass in the left usually.
Left side. And there is a scar mark. So this scar mark can be due to meconium ileus or not.
It can be because of the meconium ileus and any lower bowel surgery, most likely ileocecal surgery.
Yeah. So it's going most probably of if there is mass and there is surgical scar is there. So it's going like a Crohn disease most likely.
Then there should be finding, no anemia, and this all things should be there. Like my
Uh,
case, what he gave is like constipation mass. So I was
so constipation mass should be left side, not on the right side.
yes, yeah, correct. Mostly it is on the left, mostly.
Most if you are feeling a mass, it's usually coming on the left side. If there is like sluggish bowel sounds and there is abdominal distension and there is constipation, but there is no mass, only constipation, then it can be anywhere abnormality, like acute abdomen. I mean to say, acute abdomen anywhere abnormality can be there. But if it's simply a constipation only and there is no sluggish sounds, then it will be on the left side.
Yeah. Here, like you have, I think, like if we put a broad differential, first of all, acute abdomen unlikely. There is no tenderness, nothing, right? There is no pain, nothing. So number one is less likely. Number two, scar, which is on the right lower quadrant or right, I mean, from the picture, looks like above the umbilicus. So uh, right hypochondriac region rather than right lower quadrant. So this scar can be for like any gallstone surgery or
Okay, Dr. Vakar will come. We will see what can we can ask him what he was thinking.
mm.
So our next, who is the next candidate?
But let's just discuss this thing. Like if the scar is on the right hypochondriac, means most likely gallbladder or liver surgery or
maybe pyloromyotomy.
See, if the scar is on the right side of the abdomen and it is in the lower side, lower abdomen, so scars can on the right side and the lower, it can be any surgery to the kidney, like kidney transplant,
Yeah.
okay, or any small scar is there, any maybe biopsy is taken from the kidney. So it can be a surgery in the Crohn disease,
Kidney
okay.
scar, usually Rutherford Morrison scar, this like a hockey stick kind of, and there will be very like superficial palpable transplanted kidney. And
Yes, that
if there is a nephrectomy or something, then the scar will be on the flank, like nephrectomy scar.
yes.
So only Dr. Vakar can tell what he was thinking, because the case related to me was like a constipation. So I
It is,
thought he was
yeah,
having.
if it is in the upper quadrant on the right side, then we will have to think of gallbladder surgery or we have to think of the liver surgery.
Yes.
So I don't know what Dr. Vakar was thinking by himself. He has given the scar, he has told the sluggish bowel sounds and the this may be distal intestinal obstruction, but why there is a mass on the right side mass, and in the lower quadrant always almost is due to ileocecal mass, and ileocecal mass is coming in the Crohn disease.
Yes. His picture was going towards the kind of ileocecal or cecum or lower ileum or at the junction.
Mm. Okay, he will come and we will discuss what we can say. What he was thinking, he can tell only.
No, but the other thing is like how we have to see the verbalization of technique means what means I have to like from the when I enter in the room, I will verbalize. Now I'm like because of online, let's say online, how I would say I would just like
Online, they are saying that you will give the commentary. I am going to look the hands. If there is any problem in the hand, they will show you the picture, or they may tell you, yes, there what you want to see in the hand. They can ask you, I want to see the clubbing, I want to see the pallor, I want to see the erythema or stigmata of the chronic liver disease, stigmata of the infective endocarditis. I
that.
want to see sign. If there will be any positive, they will show you the picture. So
Yes,
that is your finding. You will pick from the picture. So this scenario will be like this: you are going what I am doing, and what you have in the patient, they will show you
yeah.
this kind of they I mean to say, you will be focused on the screen. The same time, what you are doing, you will be focused in the mind also.
Yes, but if I have to say, I will say like yes, now I'm washing hand and I'm looking for the unusual feature, for the build, for any special
No,
something.
unusual for the unusual features, they will give you the picture. If there is any unusual picture, you can write down, and at the end you can tell that I have found these unusual pictures, but you will not give the running commentary
Dr.
in.
Dr. Rohit and Dr.
Mm.
Haran, it is acceptable to say the constipation lead to some surgery.
No, I mean to say there is a constipation mass. So constipation mass is
No,
usually
that we are
coming.
talking about. No, we're talking about the scar, right?
Scar is
Yeah,
not
scars can be.
constipation.
Scar can.
No, we
Bowel
should not use
surgery, we have discussed.
constipation. We should use intestinal obstruction because of
Yeah,
constipation.
this
I
one we
mean,
have
it's
used already. But why mass is there on the right side?
on the right side. Why? What is the causes of mass on the right side?
So
That
that's we are.
Uh, I
Okay.
want to ask, does this child had the clubbing or not?
no,
No, there is no
no,
clubbing.
no
Actually, the first,
is
the
nothing.
second thing, mass on the right side is usually in the Crohn disease. On the distal intestinal obstruction, sometimes may have mass on the right side also.
Yes.
Yes.
Okay, so I
And
was just thinking that if there is a scar and this mass, the child might have cystic fibrosis, had the surgery
we
in
have
the
discussed already this
pneumonia.
one. We have discussed already this one, but there should be then other finding also. There
How
Yes,
should
old
be
the
a
that's
baby,
what
this
I was
child?
asking.
Dr.
That's what I was asking.
Rohit, how old the
Hmm.
baby is, this child? How old?
I don't remember 5 years or 4 years.
Yeah,
Told maybe.
4 years.
So what was the command from the examine the abdomen, right?
Examine the abdomen.
He
There
looks
is
small for,
the,
okay, he looks small for age. Did he check
yeah.
any cannulation mark on the hand?
Yes,
No,
yes.
no, nothing there.
Nothing is
Okay.
happening.
So can be possibility of premature baby? He got a bowel surgery when he was neonate.
Yes,
I was
Number
thinking
one,
maybe this meconium ileus they have done the surgery.
yes.
meconium
I was
ileus,
also
and
thinking about Hirschsprung disease, but you are saying that the mass is right-sided.
Sprung will be on the
Yes,
So,
right.
this is actually the I'm not getting actually. Maybe Dr. Vakar has something in mind, or maybe Dr. Bhatti has reached to the diagnose, but I'm not reaching to the diagnose.
First,
What can I say? If the scar is on the right side and the lower abdomen, almost lower, not in the upper. This is in the
it
lower
is
segment.
just adjacent to the umbilicus, right?
Yeah, adjacent to the
Okay.
umbilicus.
So laparotomy less likely because usually they are doing, I think, vertical scar in the small babies.
Yes.
Usually
Okay.
laparotomy for,
Even though it's laparotomy, then why
yeah,
mass? I'm not getting the mass. Why is mass is there? And mass is from the
on the right
constipation.
side. On the right side.
Yes.
Yes, on the right side.
right?
Constipation mass is usually
Left
not
side.
coming from the right
Yeah,
side.
yeah, left side. Well, you're right.
So, right iliac fossa mass, like let's say if right mass is in the right hypochondriac, means enlargement of the liver or any malignancy tumor from the liver, or simply infections, inflammatory or vascular, this kind of things from the liver.
No,
Come below.
this area which Dr. Vakar said that
Yeah,
this is
that is
area is coming ileocecal area.
yeah. I'm coming to that. The middle,
Hmm.
middle area, flank area, probably kidney related thing. Then come below right lower quadrant or ileocecal region. Most likely either the ileal pathology or cecum or ileocecal valve or post ileostomy or
But Dr. Heron, I'm sorry to disturb you, interrupt you. Uh,
oh,
Talking about the renal pathology, it usually don't come in the front. Only the transplant kidney comes in the lower quadrant,
yes, that's what I'm
right side especially.
transplant kidney
And,
only comes.
and yeah, and if you do biopsy, it is taken from the back side, not from the front side.
Yes, that's what I'm
Yeah,
saying. If only
yeah,
transplant kidney, then only it will be very superficial mask on the right lobe.
yeah. Usually it is a hockey-shaped scar,
Yeah.
big scar.
Rutherford Morrison, they say it's a
Yeah,
reverse.
rotiformis. Yeah, for sure.
Yeah.
So just we can say bowel surgery was done. Maybe, and if it is well-healed scar, old scar, you can say maybe a neonatal period and bowel surgery. They don't want anything exactly, and you should tell.
Yes.
Possibility. You can say this is a possibility. So generally, you have to tell, not any specific or any very pinpoint. They don't expect like this thing.
Yes.
Okay, we should not waste more time. This is
Yeah.
already half an hour. We
Yes.
should do one
Another.
communication at. So who was the candidate, Doctor? I will read the scenario. Candidate was just 1
I
minute.
was,
Doc,
I was also in the communication.
yeah, Dr. Nihad and no, sorry, Dr. Rifat and Dr. Irfan is the first. Dr. Irfan is role player and Dr. Rifat is the candidate. Dr. Rifat with us? Yes,
Yes,
she
yes,
with us.
I'm here.
Dr. Rifat, I will read the scenario for
Yes,
you.
please. Okay.
Uh, Pediatric specialist registrar, postnatal ward, setting is postnatal ward, Mr. Dawson, mother of 2-day-old Adam. Background information, Adam was born at term after an uncomplicated pregnancy to a primary mother His birth weight was 3.6 kg. Routine newborn examination by an SHO on day 2 revealed a cardiac murmur. You have since confirmed this finding yourself. Okay. Please inform Mrs. Dawson of your finding, diagnosis, and plan management.
Okay.
If you are ready,
Yes, I'm
I
ready.
will. Dr. Irfan, are you ready? I will put the time.
Yeah, give me 1 minute, just 1 minute.
Okay, we have shortage of time, maybe.
1 minute won't give you any problem, boss.
No. I'm just saying, I'm seeing the time. If it will close, then who will open?
Yeah,
Who can
I got your point. Okay. So what we can do, anybody can be like that.
No, you can do, no problem. Still, we have 10 minutes. You can do this one.
Okay.
If he will not, then I will put the my meeting ID.
Yeah.
Okay, that's great.
Okay.
Okay, if when you ready, tell me.
Yes, I'm ready.
Okay, Dr. Rifat, you can start
Yes.
now.
Yes. Hello. I'm starting.
Yes.
Hello. Good morning.
Good morning.
I'm Rifat, one of baby doctor. I believe you are Mrs. Dawson, Adam's mother.
Yes, doctor.
Nice to meet you.
Oh, same here.
Okay, so first of all, I would congratulate you for having a baby.
Oh, thanks a lot, doctor.
How are you doing?
I'm okay, doctor.
That's good. So, how is doing Adam?
He's okay, fine, doctor. I find he's quite playful.
Okay,
Yeah, he's
so
feeding well.
that's good.
Yeah.
So I just want to discuss about the Adam's health. Health. Um
Condition.
yes,
Condition.
health condition. Is it okay?
Yeah, okay.
Okay. So, do you want anyone else to be with you?
No, doctor, I'm alone today.
Okay, that's okay. So, have anyone tell you about his condition?
Yes, they were telling something that he has some extra sound, but I
Okay,
didn't understand, doctor. What is this actually?
okay. So I will help you in understanding all this thing.
Yeah, thanks, doctor.
Uh, oh, you're welcome. So, there is an extra sound in the Adam's chest when we listen his chest with the stethoscope. Okay.
Okay, doctor. Yeah.
So this sound is called murmur. Okay.
Doctor, this is a dangerous thing.
Uh, there are different types of these noises. Okay. So some are associated with normal condition, which are normal, and the child also outgrow of it. Are you getting me?
Yes, doctor. Can be
And
normal also, you mean?
yes. And sometimes there might be some underlying heart problem. So in this way, we have to evaluate the baby in that direction.
Okay,
Okay.
doctor. Hmm.
So we have discussed the murmur and the two types of the murmur. Okay. So
Hmm.
in the Adam, I have examined Adam thoroughly, and we found that this sound is most likely it is normal. That, as I had already mentioned, that it could be normal or abnormal.
Okay,
But
doctor.
we Okay, so this is a good thing that he is growing, he is feeding, he has no breathing difficulty, he is pink in ear, and his weight is good. So
Yes,
all
doctor.
these findings, they are heading us towards the thinking that he have the normal heart, but the sound
Doctor,
could be yes.
you mean this sound is present in all children, all babies born with this sound?
I appreciate your knowledge. Not all the babies, but some of the babies they have this extra sound, and out of those babies, majority of them have normal heart. Is it okay?
Okay, doctor. But why he is
But they
being investigated? Why you are so worried if it is normal and
yes
if
yes.
so why we
Uh,
worry?
Basically, all these babies we have to keep in review. We have to review these babies later on, like at 2 to 6 weeks, so that we can find out any other abnormal finding or the unusual finding the child is developing.
Okay,
Sometimes this is okay, so we have to keep an eye on it and we have to follow it. If the baby outgrow of it, then there's nothing to do. But if
so
some
doctor, how
unusual
we will
feature,
know
yes,
this sound is outgrown? How I will know?
we will call you for the baby's review with the consultant, most probably at 2 to 6 weeks of life. And then
Hmm.
the Adam will be reviewed by the consultant. He will listen to his chest with the stethoscope. He will check his growth and feeding difficulty, if he have any feeding problem, and the quality of this abnormal sound. If he thought that there is some unusual feature, then we can refer him to the heart doctor. And if there is no that sound, it means that the baby is outgrown it. Is it okay?
Doctor,
Are you getting me?
yes, yes, doctor. Thank you for your information. I want to go home because I have some work to do. So
Okay.
it's okay. So can we
Yes.
get discharged?
Yes, sure. We can give you discharge because we have examined, checked the atoms thoroughly. And I will
Hmm.
give you some trusted material. That means that I will give you some information about the baby who have this condition and might on develop these features, and you have to seek the medical attention urgently. And I will also give you the follow up for the
Okay.
baby at 2 to 6 weeks, and
Hmm.
then you can be discharged. Okay,
Okay.
so I will tell you the what are those signs that would be mentioned in the literature, in the leaflet as well. So if Adam have at any point in time have breathing difficulty or sweating while feeding, or the
Hmm.
baby having the blue color lips, or the peripheries hands, or he have
Minute,
uh, any
6 minutes.
skin color change. Okay,
Hmm.
skin color change. You should come to the to the hospital. You have to
Okay.
come urgently.
Okay,
Okay,
doctor. Hmm.
and if he
Doctor,
is doing fine, yes.
doctor, we are planning for next child. So same condition would be in my next child also.
Not really, because as I told you that not all the babies have this condition. It might be possibility that there would be that this condition would occur in the same in the baby as well. But we cannot say surely that whether that baby have problem or not. So
Okay.
at this point in time, we are not in position.
Doctor, before we go home, we need any investigation, anything. Do you
Right.
recommend anything?
No, right now we have just checked baby thoroughly. We checked the oxygen level in the baby. It's all perfectly normal. At this
Okay,
point in time, there is no need of any investigation. Okay.
okay, doctor.
So, do you have any question?
Just okay, doctor. Thank you for your information.
Okay. So, I would just rephrase it for you if you don't
Yeah,
mind.
it's okay, doctor.
Uh, okay. So that the Adam have an extra heart sound that
Yeah.
is audible with the stethoscope, and it's this extra heart sound called murmur. So this
Okay.
murmur sometimes they more present in the babies, and mostly this is there is no underlying heart problem, and the baby will outgrow of it. But sometimes there may be some underlying heart problem, and this is the
Mhm.
reason why we keep all those babies in our review at
Okay.
2 to 6 weeks with the consultant. So we
Okay,
will
doctor.
check the Adam at our clinic, and I also have given you the trusted material, so
Okay.
that if you find any unusual feature, you have to come back immediately to the hospital.
Okay, doctor.
Okay. Okay,
Thank you,
thank you
doctor.
so much. Thank you so much.
Thank you.
Okay, so how much time is left?
1 minute.
Half that
Half
30
minute.
seconds.
Okay.
So you can
Okay,
have
that's
another meeting, and like that, you can add, as you mentioned that. Yeah.
Give your feedback, Dr. Bhatti.
Well, Dr. Ifat, it was a good attempt, I must say, and introduction was nice, and you make sure she is a mother of the baby, Adams, and you also invited anybody else to join this discussion, and you check the prior knowledge also. That was great. And
Mhm.
secondly, you didn't take the help of diagram.
Yes, I was thinking that the screen sharing might be difficult because Dr. Vakar is not there.
Okay, just then you have to mention now. I would like to, uh,
Okay.
yeah, if you are keep this thing in the reflex,
Yes,
so that
yes,
we should not forget in the when we're
yes.
doing in real things.
Mhm.
And secondly, it was not explained why this hot sound comes.
Yes,
It was not
yes, I
explained.
was
I'm sorry.
expecting, yes, I was expecting that this question might be raised by mother.
Well,
So,
I was in between. Just you told me it is normal. Your impression was just you given the
okay,
impression it's quite normal thing.
okay, okay,
But
okay.
you can say it can be
Yes.
because of the.
Can I
Oh,
answer? Can I answer first and then you will add in it?
yeah, sure, no
Okay.
problem.
Okay, so sometimes the babies they have slim chest that is very close to the stethoscope, or
Yeah.
sometimes and their heart they beat faster than the other